Dr. Boyle, my predecessor, Congressman Weldon, was a well-respected, competent medical doctor, and a great deal of esoteric expertise on this subject that I'll probably never have. But I gleaned from him some certainty that he felt the thimerosal in vaccinations definitely was a contributing factor to autism. And I read not very long ago an article that it said until the wonderful people like us introduced vaccinations to Africa, the African children basically were autism-free. They never heard of autism, never had a case of Down. Are you familiar with that? Have you ever heard that before? Okay. I wonder if the CDC has conducted or facilitated a study comparing vaccinated children with unvaccinated children yet. Have you done that?
We have actually done a number of studies looking at the relationship between thimerosal vaccines and autism and other developmental disabilities. And there have been, since, actually over the last decade, there have been numerous studies looking at the relationship between vaccines and aspects.
That the CDC conducted?
Some of them were conducted by the CDC, others were conducted by
How many would you say? Would you estimate?
I would actually have to check with the specific numbers, but I know there were two. One large study looking at various neurodevelopmental disorders, and the second one that would focus specifically on autism. And those were fairly recent studies.
Would you see that my office gets a copy of those, please?
Of course.
Do you believe additional study would provide useful data in assessing the safety of childhood vaccines?
The IOM has evaluated this issue back in 2004 and again most recently in 2011. And their conclusion, again, it was not just looking at the work that was done at CDC, but with the total body of evidence, was suggesting that vaccines and their components did not increase the risk for autism.
My time's very limited here. So clearly, definitely, unequivocally, you have studied vaccinated versus unvaccinated.
We have not studied vaccinated versus unvaccinated.
Oh, okay. Never mind. So just stop there. That was the meaning of my question. You wasted 2 minutes of my time. What steps has the CDC undertaken to ensure the integrity of the research that was performed by Dr. Thorson, who, as you know, has been indicted for misconduct and misallocation of resources?
So Dr. Thorson, who was a co-investigator on a couple of studies that came out on autism, was really just one investigator, and that body of evidence related to vaccines and autism.
All right. Have you gone back to validate the variety of studies he participated in? I mean, you know this guy is a humongous scumbag, one of the most wanted men on earth, and you relied upon him for data to determine whether thimerosal had a negative effect?
So two studies don't conclude a body of work. The body of work that's relating vaccines to autism is a large collection of studies.
You told me you only had 2 studies relating to vaccines, vaccinated and unvaccinated, so you must figure 2 studies must have some weight. Running out of time quickly here. You mentioned that you only have thimerosal in multivial. Why is that?
I was actually going to get that information for the committee.
Okay. Because I would think if they only have it in multivial, if they eliminated having it in all the other vials, there was a reason.
There is definitely a reason, so I was going to clarify that.
Yeah.
There are single-dose vials and multi-dose vials.
And they took it all out of everything but the multi-dose vials.
That's correct.
Okay. How many multi-dose vials are there?
I can provide you that information.
Okay. I've seen a chart that ranks the longevity of the 30 nations with the best mortality rates in the world, starting with Iceland, Sweden, Singapore, and on down. We didn't even make the top 30. We're the 34th. And ironically, we require more vaccinations than any other country that's healthier, has a less mortality rate than us. Do you see any correlation whatsoever, either one of you, to the 34th worst mortality rate and the most vaccinations to the ones with the least required vaccinations and the lowest mortality rate? They also have children that, past age 20 in those countries too.
There are many factors obviously involved in longevity for any country. The one thing we do know about vaccinations is that they are among the major public health reasons why generations today live much longer than in previous generations. They are perhaps the most successful public health movement in the world.
Nobody's talking about or against vaccinations.
Well, I was just trying to answer.
We're talking about thimerosal in vaccinations.
I was trying.
And multiple, bomb blast of vaccinations in short period of time on very, thank you, Mr. Chairman. My time's up.
I'm sorry, the gentleman's time has expired. Did you want to answer?
No, I think I had an opportunity. Thank you.
Okay, very good. Then the next person, the gentleman from Kentucky, Mr. Yarmouth.